Healthy Conversations is made possible through a grant from the William L. and Ruth T. Pendleton Memorial Fund.
Thank you for joining us today for today's virtual Healthy Conversations. I'm Nancy Thomas, Director of Volunteer Services at Dignity Health, YRMC. I've been with the organization for 13 years and in the field of volunteer management for 25 years. I have the great privilege of working with over 600 individuals that lend their most valuable resource, and that would be their time. And of course, their contributions go beyond the time that they give us, the hours that they give us, but really their expertise that they lend, their ability to really help us deliver what we try to attempt, and that is our total healing environment. Great individuals, and I'm thrilled to be able to talk about that today. So today we're going to talk a little bit about volunteerism as a whole, as well as how we engage our volunteers at Dignity Health YRMC. So let's get started. When we look at the nation, we have over 1.3 million nonprofits in the United States. And of course, many of those nonprofits utilize volunteers. It's estimated that there's 77 million volunteers. And so you can imagine the contributions that they give to the nation as a whole and the organizations that they serve. The independent sector is an organization that really looks at volunteer contributions throughout the nation, throughout the world, actually. And they value volunteer time at $27.20 an hour. And so if you look at 77 million volunteers and what they're giving to the organizations worldwide and nationwide, it's quite a contribution and really effective of the bottom line for those organizations that they serve. And I think about volunteerism as a whole, and it really has a rich history. There's some photos here of our organization from years ago when we celebrated our 75th anniversary, which is kind of cool to look at, and how the professions that really have been founded by volunteerism is a wonderful and a rich history. I'll concentrate mainly on the healthcare industry just because that's what we're talking about today. And we look at some of the professions that have been defined and started as a volunteer. So when doctors first started treating patients in hospitals, for instance, they decided that they needed some help. And those helpers later became RNs and nurses, which of course are a vital part of what we do for any of our patients and our family members that come into the hospital. And then we look at our social workers or care managers, as they might be called. They started off as friendly visitors and turned into a profession. And of course, they navigate the patient's and the family's journey through the hospital stay, as well as what happens when they're discharged. And then in the early 60s, what we found has happened is that we really needed to coordinate the volunteer efforts for all of these nonprofits. And the hospitals were one of the first really to start employing individuals to be volunteer services managers, which of course is near and dear to my heart with the work that I do. And so it really has a rich history as far as volunteerism and what it's done for all of the individuals that use these nonprofits all throughout the nation. And I think about the hospitals and those early days of volunteers. They were called the Pink Ladies, and we also had candy stripers. It was really fun. Not too long ago, I interviewed a prospective volunteer, and she said, I was a candy striper. And we just don't hear that term much anymore. But it was really fun to hear about that. And even though we don't use the term anymore, we certainly utilize the services and what they give to our organization for sure. So many times when we think about volunteerism, we think about what it is that they give to the organization. But actually, the volunteers get as well. There's a real helper's high. Volunteerism as a whole is really good for your health. And again, talking about that helper's high, it's really a wonderful thing. There's research that has documented this. Sometimes people say, oh, well, if you're healthy, you'll volunteer, and that's why you are older, etc. That's really not the case. That volunteerism will contribute to lower stress levels, lower blood pressure levels. It manages chronic illness. There's a decreased risk of cognitive decline as well. And it's just fascinating to look at some of the research. Basically, it enriches a person's sense of purpose. And when you do that, you're giving to others, you're surrounded by others, and it just makes you feel good. There's also a sense of community. And then I think about some examples that I've encountered over my years in volunteer management. We've had a number of individuals that, for instance, maybe have lost somebody, a spouse or a close family member, and they're really deep within the grieving process. And they, for some reason, decide to come out and volunteer. And being with other people, talking with other people, giving back, helping others really helps with that grieving process. I've had many, many volunteers that have said, gee, I just didn't know that I would ever even come out of my house again after my husband died. And then I found out that I had a sense of purpose and I came to volunteer, and it was really, really helpful. I had one individual that was going through a bout of depression. And throughout his therapy, his therapist actually said to him, I really think you ought to volunteer. And so he came to me at an organization that I worked at, and we started getting him going with volunteerism. And when he first came in, his demeanor was really quite sad, and you could just tell that he wasn't himself. Over the course of 3, 4, 5 weeks, I could just see this lightness kind of surrounding him. He was smiling a lot more, he was engaging more, his steps were lighter. And he talked about this with his therapist and really felt that the volunteer activity that he was involved in was really helping him get past his bout of depression. So this helper's high, I can't minimize that because it is really, research has proven it by many, many different organizations. And so it's not only about what volunteers give, but it's what they get as well. So we talk about, where is your volunteer heart? For instance, in our organization, where do you see them? Many of them are extremely visible. You notice them right away. In fact, I'll tell prospective volunteers that there could be instances where a person comes into the hospital for the first time and they may encounter 3, 4, or 5 volunteers before they ever even see a staff member. And it could be from dropping off, or I should say parking their car. And then we have little golf carts that come around with our volunteers that are staffing those, and they give them a ride to the main entrance. One time I was leaving work and I stopped at a little shop on the way home and I had my name tag on, and the person at the counter said, oh, you work with the volunteers at the hospital? And I said, yes. And she said, well, let me tell you a story. And I love this story. She said she was scheduled for an MRI recently, and she got to the parking lot. She was extremely nervous, had no idea what this whole appointment was going to be about. And she knew that she was going to be in some kind of a tube, and she was a little bit afraid of that. So she got in the golf cart with the cart driver and shared that story with him. And he said, you know what? I've had an MRI before, and let me tell you all the story about it. And I know our staff would have explained that to her too when she got into the hospital, but here she had a little bit of a prelude to that from somebody who had actually experienced it themselves. They weren't a medical personnel. They could talk about the MRI and they could say, you know what, I survived it and so will you. She said, I felt so much calmer by the time I got into the different procedure room and got started. So she was really thankful. And it was kind of fun to hear that story from a member of the public that was unsolicited. On a more serious side, with our cart drivers, I had another story where an individual called me up and she said, do you manage the volunteers? And I said, yes. And she said, well, let me tell you, I think that your volunteer and the cart driver, that was the cart driver the day before, saved my husband's life. I thought, well, this is intriguing, so I wanted to hear more naturally. And she said that he was experiencing some chest discomfort and some chest pains, and so they drove in and the cart driver was right there, pointed them to the area where they could park, picked them up, brought them into the emergency room, and of course he got treatment right away and he was just fine. But she really felt that the cart driver saved his life. Now, whether the cart driver saved his life, we really don't know. But she was so appreciative and her gratitude was sincere. And so that's a really highly visible area as far as our transport. I also think about the times where they're at the reception desk or maybe they're in a waiting room and it's that person right there that can help them navigate their way through what's going on. And we have volunteers in a number of waiting rooms, for instance, surgery or the cardiac cath lab and others as well. And about 2 weeks ago, I was up to see a volunteer just to say hi. And she was in one of the waiting rooms talking with one of our visitors. And her husband was having a procedure that morning. And so pretty soon I was engaged in the conversation as well and got to know the individual. The next day, I was at the information desk when the woman was coming in to see her husband. And she said, "I recognize you from yesterday." She said, "I have got to tell you about this volunteer." The volunteer's name is Sammy. And she said, "She was a game changer for me. I was a mess when I came in. I was anxious, I was worried, I was concerned." And pretty soon, Sammy and I started talking, found out that we had a lot in common. And I just I stopped really worrying about what was going on with my husband and could really just engage in this conversation. So it made a huge difference to her, and it was really fun to hear her story and to receive those words of thanks, which of course I passed along to our volunteer as well. And then we have some areas that maybe aren't quite as visible, but they're behind the scenes. And that makes all the difference too, because what they're doing behind the scenes, as far as the volunteers, what they're doing is helping the staff. And so the staff can do what they do best, and that's treating the patients. And so whether it's collating some materials behind the scenes, doing some office work, supporting them in whatever it is that they do is huge. And then related to that, we also have volunteers that aren't directly on campus, and we call them off-campus volunteers. What they do, or they do some stitchery projects, and they lend their expertise and their talents to our organization for various reasons. So, for instance, we have individuals that have surgery, and we have a group of individuals that will make little pillows, and these are really helpful for our post-surgical patients. Maybe they need some support behind their back or on their chest or incisions, etc., or maybe just an extra pillow to use as they're recuperating. We had a volunteer one time that knew about these pillows because she worked in the volunteer office and she would see them come through, and she said, "Little did I know that I was going to be a patient and then be a recipient of one of those pillows." So that was a great thing for that individual to share. We have some people come to the emergency room and they don't necessarily know that they're going to end up having surgery, and they have glasses. And so we have individuals that make little eyeglass covers. And so it's some place to keep their eyeglasses safe while they're having their procedures accomplished. Then we have little ones that come to the emergency department sometimes, and they're extremely nervous, of course. Our adults are nervous when they go to the emergency room, so you can imagine our little kiddos. And we have little bears that we give them, and there's a little heart on here, and there's a little tag on the back that says, "Hug me, I'm yours." So something, again, to divert their attention from what's going on. Additionally, we have toys made by the Yavapai toy makers. They're little wooden toys, and we give these to our little ones that come to the emergency department too. And so pretty soon they're playing with the toys, and they're really not thinking about what's going on behind the scenes, or maybe those scary people in white jackets. And then all of our families and our babies that are born, we give them something that is made by a group of individuals. And so it could be quilts, it could be layouts, it could be booties, it could be little hats like these. And it's really fun to give these away to our brand new moms. I happened to be in the family birthing center one time, and a mom was getting wheeled out with her brand new baby, and she was pretty excited, and she said that her first child that was born at the family birthing center, she got a quilt, and this little boy, that became his favorite quilt, and she said, "I got another quilt this time." And she said, "I'm guessing that this new baby will enjoy this new quilt as well." And so we even have individuals in the comfort of their homes that are volunteering for us, and we give these items to individuals, and the people that are at home and they're making and they're stitching and they're sewing, they have no idea how they're touching other people's lives, and they're people that they will never meet. And it's just a wonderful gift on behalf of the hospital. We have a couple of gift shops at each campus, and these are great little areas for people to go to. And it's not even about the merchandise that's sold sometimes. It's also about individuals that come there for a little bit of a break. What's going on? Maybe they've been there with a loved one with an extended stay, and they just need a break from the room, and we call it shopping therapy. Again, whether they buy something or not, it's really helpful to just have that diversion away from what's going on in the hospital room necessarily. And there's great merchandise too, by the way. So for people that are purchasing, whether it's a gift for a family member, as well as our staff that avail themselves to a quick shopping trip, it's a really great service. So our gift shops are wonderful, extending some additional customer service and some retail opportunities for individuals that visit there. And then we also have complementary therapies, and these are a couple of volunteer areas of service that people see readily when they come to the hospital. The first one that I'll talk about is our pet therapy. And if you have been to the Prescott Christmas Parade ever, you will have seen our dogs and our handlers in that particular event. What's really fun is people start hollering out different names of dogs, and they'll say Sophie or Tama or Tucker, and they have been visited by one of our dogs. Whenever our dogs and our handlers visit, what we do is we hand out little business cards, and it has a picture of our dogs, and then it has some information behind. And I love it because it talks about the breed, it talks about the favorite toy, how long they've been volunteering, etc. And these business cards are often keepsakes for individuals. We were doing an event one time, and it was a recruitment event for some additional handlers at the hospital. And a woman came up to me and she said that her mom had been in and out of the hospital many times over the past year, ended up passing away, unfortunately. But as the family was in her home, kind of cleaning things up and looking through her belongings, they looked in her jewelry box, and she had business cards of every dog that had visited her over the past year. And so the family members knew that this was really important to the patient during her stay. We've had situations where we had a handler and a dog. It was a boxer of ours that went into a family, or I should say a patient's room one time. The nurse had said to the handler, this person really has been nonverbal, really quiet, just feels maybe a little bit down in the dumps, of course, just depending kind of what's going on with them medically. And so she asked if they would come in and do a little visit. And within just a few minutes, the patient had the hand out, was petting the dog, and then started talking. It was the first time that he said anything that day. It was a really touching moment. And so our pets really do bring out the best in our patients sometimes and stimulate some memories. There was one instance where an individual said, I really miss my cat. Well, we don't have cats, unfortunately, in our pet therapy program, but we then offered to bring a dog in, and that really did suffice. So that was helpful. We have an artist that comes in, and she paints whatever she feels like that particular day. There was one day where she happened to be painting an orchid, and there was an individual that was coming in for surgery, and her son was with her. And he came over and he said, I can't believe you're painting that orchid. He said, because I just gave that very same orchid to my mom last night because that's her favorite flower. And so the artist then said to him, why don't you stop by after the surgery is over and we'll talk some more. And so he did stop by, and she was finished with the orchid at that point, and she handed it to him as a keepsake. So that was just really a touching moment between the two of them. And we have musicians that come in as well. We have individuals that you may hear in the lobby playing the piano. We have harpists. We have acoustic guitar. We have an individual that plays a Native American flute. And there was an individual one time that came in, and it unfortunately was an end-of-life issue, so very sad. And they were coming in, and she heard the flute music in the background, and she said it just really calmed her down and centered her a little bit. In fact, she then sent our CEO a message, and she thanked everyone really for the great care that her son had received at the hospital. And she also included the flute player, and said when the moment she walked into the hospital and she heard the flute playing, it really helped her again, center her, and so it made a really big difference. We had a harp player one time, and she was up on one of the patient floors, and she decided to just play in the hallway, and of course that music just resonated all throughout the hallway. And then later she was down in the cafeteria having lunch, and a staff member that had been up on that floor started talking with her, and he said, I can't believe how much you helped me. And so the benefit really is for the staff as well. And as you can imagine, our clinical staff really do have some high-stress jobs sometimes. And he was so grateful, he said, I really want to buy you lunch to thank you. So she did decline because she said, we get a free lunch because we're volunteers. So she declined the lunch, but she really appreciated the gratitude that he extended on behalf of the music that she had shared with them. So, and live music really has many more benefits than, like, for instance, just playing a CD. That resonance that comes out of live music is huge, and it helps our patients, our visitors, and our staff alike. So it's a really cool thing. In fact, thinking about all three of these, there was a staff member that came out into the lobby one time, and she saw the artist, and she happened to see a dog, and then the music was playing as well. And she just put her hands out and she said, I just love this and I just needed this. So very helpful for everybody that encounters it, which is a wonderful thing. Okay, then we have 2020 happen. And seeing that number spin was pretty much how we felt in the volunteer world, because we were so used to having the benefit of 50, 60 volunteers a day that came into both of our hospitals and our clinics, et cetera, that help us. And all of a sudden that didn't become safe anymore. Of course, our world turned upside down in the middle of March. And we had 5 weeks where we actually had to suspend all volunteer involvement. And oh my goodness, what a change it was in the organization. Staff and visitors or patients, et cetera, really talked about not seeing those volunteers in the various locations, et cetera. And it was really hard on the volunteers as well. And it was just, I can't tell you how different it was just to be walking throughout the hospital without having that presence again of more than 50 volunteers a day doing the various things that they do. So we went from the beginning of the year seeing the volunteer smiles, as you can see here, and then having to go to masks, which of course many of you that are watching this could be wearing one right now or have experienced that as well. What I have to say about 2020 and the year of volunteerism, when we brought volunteers back in different segments or different areas of service, they were really good sports. They really wanted to help, and they were excited about coming back as well. We had individuals that weren't used to all of a sudden having to be home for a month or two at a time, not being able to come in to volunteer. I called one woman one time and said, guess what? Your area of service has opened and can you come back? And she was so excited. She said, I felt like a little schoolgirl on approaching my first day of school the next day. She said, I got my uniform out. I made sure it was clean, got my pants all ironed, got my badge out. And she said, I got to set my alarm for the first time in a couple of months. And she was so excited to come back and do what she loves to do, and that is actually to volunteer. There was one individual that said, Nancy, you've got to let me come back. She said, I can't get my house any cleaner. I can't get my garage any cleaner. I can't give away any more things that I've been purging ever since this time at home. And so it was really good news when we could actually bring her back, and she was happy about that. We had one individual that said, Nancy, I know my area of service hasn't opened up yet, but I set my alarm clock every Wednesday just because one day I'm going to need it again, and I can't wait for that day to happen. So while our program isn't quite as vibrant as it once was, we still are enjoying, even though it's a fewer number of volunteers, we're still enjoying those that are back. And our goal throughout the whole time was really to maintain their safety, of course, and I appreciate the administrative's stance on that. And when they did open different volunteer areas of service, we really just about wanted to open up roll out the red carpet to have them back. But during that time, we also had to get a little creative with some of the events and some of the ways that we honor our volunteers. And you can see some pictures here where we had some award winners that were presented with their award for Volunteer of the Year and various other items. And then we also had to go to people's homes sometimes to surprise them with their awards when we couldn't have them come into the hospital. And featured in the middle of this particular slide is Dorothy. And Dorothy is our longest serving volunteer. She's been with the organization for 40 years. And that certainly rivals some of our employees that have been with the organization. And so what we did was we went over to her house and presented her with her award. And her family was out in the yard, and we all had a really good time just to talk a little bit about what volunteering has meant to her for so long, and also some of her experiences, and reminisced and honored and really celebrated her. And so we had to get a little bit of, we had to exercise a little creativity, I guess, with trying to honor our volunteers, even though we couldn't have them in-house at that time. Our volunteers do wear uniforms, and it's really helpful because we can tell who they are and how they can help us. In fact, we'll tell people if you're trying to navigate your way from point A to point B, just find somebody in blue, and they'll help you get to where you're wanting to go. Here we have pictures, though, of volunteers that are not dressed in their volunteer blues, as we call them. And instead, they're celebrating different holidays. So we do give them a break, and they love it. And as you can tell, they dress up a lot and have some fun and really create some festive spirits, I guess you can say, whether they're at the front desk or all throughout the hospital. And our individuals love having that little sight when they come in. Sometimes people will ask, well, what really causes a person to volunteer? In fact, I was telling somebody about my job one time, and he said, you mean you get people to come in and they do things for you and they don't get paid? And he couldn't wrap his head around that. And I was really glad that a whole lot of people can wrap their heads around that, because they do come to volunteer. And when we think about what brings them to YRMC, there's so many different reasons why they come. A real common one is either a family member or they themselves have been to the hospital and have experienced really good care. They want to give back. We had an individual that said, the hospital saved my life and I would really like to give back. I can't do it in the form of monetary donations. I don't have those kind of funds, he said, but I can give my time. And so he decided to come back to the hospital and give his time, just really to thank the staff for everything that they did for him. We have individuals that are newly retired, and kind of like the individual that said she wanted to come back because her house couldn't get any cleaner, we had a newly retired individual that said, really, my house is spotless at this point. I need a sense of purpose. I need to be with other people, and I'm ready to give back. And so what can I do? We have students that come in as well, and they're really trying to augment their career, maybe even help make some career choices. Volunteering looks great on scholarship applications. It looks great on applications to get into college. We have some students sometimes that will come in and maybe they have a certain career in mind, and they come in and just kind of rubbing elbows with some of our medical and our clinical personnel either helps define that, yes, that really is the right career for me. Or sometimes they find out, maybe that's not the right career for me. Maybe I'll try something else that I've seen in another department. Both of those are equally successful because it really has given them some sort of a shortcut to some of their career and their educational endeavors. And then we have individuals that sometimes are between jobs and they really want to keep their skills fresh. When I first moved to Prescott, I ended up volunteering at an organization, and again, just really wanting to keep my skills fresh before I ended up landing a job at Dignity Health YRMC. So there's lots and lots of good reasons for people to come and volunteer, and they, for the most part, I can't think of anything negative, but there's always something positive that has resulted in their time with volunteering. And so it's really cool on my end to hear some of those stories with our volunteers and what they have gleaned from their volunteer service with our organization. Really appreciate your time and attention to the world of volunteerism at YRMC. We really try to make it a meaningful experience, and the contact information is on the slide for you if you have some interest in exploring some maybe volunteer interests. Sometimes people come to us and they have a certain skill set, and we'll do our best to find an opportunity for them. And so I'll be happy to take some questions now if that works for you. Well, we are a hospital, so we have a few hoops to jump for our prospective volunteers, but we really try to make that as easy as possible. So sometimes we think of ourselves as almost being matchmakers. We have the need from the organization, and then we have the prospective volunteer with a certain interest and a certain availability and a certain goal, motivation, et cetera, that has led them to call us to volunteer. And so initially what we do is we meet with them and we really do an informational interview. What are they hoping to get out of the volunteer experience? And then we look at what our needs are and see if we can make a match. And it's really a nice time to get to know people and really provide what we hope is going to be a meaningful purpose for them, to engage them in a meaningful way. And then we get into a little more of the details. So we have an application process. We do a background study form on all of our prospective volunteers. We do tuberculosis screening. And then we do an orientation. We want them to feel comfortable with their volunteer service at our hospital. And of course, we also want to go through some of the guidelines that we have to ask them to follow as they volunteer with us. And then once that is all finished, then we do the training and we get them going. And again, I can't emphasize enough that we do really have a professional approach to our volunteer involvement, but we make it user-friendly and we guide them through the whole process. And they usually feel really well versed by the time they actually start volunteering. We have a number of opportunities. One area that I'll highlight, we call it a volunteer ambassador, and basically they're friendly visitors. They go in and visit with a patient. Sometimes it's the family member as well. We have individuals that might be a little bit lonely, might be a little scared, might be a little anxious, and just having that conversation with somebody is really helpful. These volunteers excel at their listening skills, their ability to engage in a conversation, kind of walking into a room cold, not knowing what they're going to encounter, and just have that opportunity to really connect with individuals. We had one ambassador that talked about a repeat patient that came in various times throughout the year. And she said she happened to be on every time that this individual was admitted, and we're not talking like many, many times, but maybe 3 or 4 throughout the year. And the volunteer's name is Norma, and she said this ability to connect on an ongoing basis was huge, and really felt that she made a difference in this patient's ability to navigate her way through the different processes that were going on. We also have our Family Resource Center, and we have individuals that go in and meet with our brand new moms and help them with any questions that they might have, and so that would be another patient care area. We have individuals that go in and they do some surveys, make sure that they're satisfied with their meals, and make sure that things are quiet. And so those are really helpful, because what sometimes can be just a little bit of an irritation, these individuals can address with staff members and really solve that on a quick and a fast basis. So that's just a little sampling of some of our patient care areas. I already talked about our dogs coming in to visit, our musicians, etc. They, of course, interact with our patients all the time. And we do have some spiritual support, too, with our chaplains, and those individuals interact with our patients on an ongoing basis. And I can't emphasize enough how important it is to also perhaps visit with the family members who are there and really create a diversion or a little bit of help for them while they're here. Yes, we do have some of those. Some of my favorite stories with prospective volunteers are individuals that will come in and feel a little bit skittish about the whole medical operations, kind of what's going on, and they'll say, I don't want to see anything clinical, but I'd love to volunteer. And I'm thinking, okay, you're in a hospital, so we have to think about that a little bit. But we have many behind the scenes, whether it's clerical, doing scanning, data entry, maybe collating, some filing, that type of thing. And then I referenced our gift shops already. But not only do we have volunteers that help in the gift shops that maybe ring up some purchases, help people find the appropriate gift or item, clothing, whatever it is, but they also do some of our displays for us. We had an individual that actually volunteered at the White House one time, that she did displays for the White House for the holidays, and she said, I would love to do some of your displays. And so she definitely brought some expertise in that area or that arena. And we have windows kind of all throughout the hospital, and we have different items that are on display in our windows. And so she does that, as well as some other volunteers. And some of them just like to be behind the scenes and doing the pricing and unpacking the merchandise. And I joke with volunteers that are new to the gift shop, and I'll say, you get the first chance to see the new merchandise. And so we really enjoy seeing them enjoy that. And it's kind of fun, because sometimes they'll go home with bags full of merchandise and they'll say, I didn't really count on spending money while I was volunteering, but I got first chance to see some great merchandise and got to bring it home. And so it's kind of fun for our gift shop volunteers. Well, we're pretty open to that. I'll tell you what the common is. We often have volunteers come in at least once a week for 4 hours. A lot of our shifts are either 8 to noon, noon to 4, or 4 to 8 p.m. during the day. We have some some areas of service that are a little bit less stringent than that, and some that are every other week. And so we really try to work with you and your schedule. But typically a volunteer is there at least one time a week for 4 hours. We have a number of volunteers that do enjoy it, and they might be in a couple of different areas of service and come in a couple of days a week, and we're grateful for them as well. We do have a minimum age, and so a volunteer needs to be at least 14 years old. And we have no maximum age. We have many volunteers that were actually in their 90s. Our oldest volunteer is 95. And so that would be a testimony to what I talked about earlier with our health benefits of volunteering. And so we start with our students at age 14 and go as long as they can. I'll highlight a couple of areas for this. One area that I'll talk about first is our Mended Hearts program. These are volunteers who have experienced some kind of a cardiac event. And so it could be open heart surgery, valve replacement, stents, something like that. And these individuals come in and visit with our cardiac patients. Really, really helpful, because what happens is they basically show them there is indeed life after a serious procedure. These can be life-altering events naturally. And so when they come in and visit with patients, they're a testimony to what they did to help with their own medical situation recover. And they not only visit with the patients, but they visit with the family members as well. When we have a wife or a husband or a son or a daughter that has experienced their loved one with some kind of a serious situation, their lives probably will change a little bit too. And so these Mended Hearts volunteers can really support them in what they're going to experience once they get home as well. And they're really good about emphasizing, for instance, cardiac rehab, which is integral in the healing process for our patients who are experiencing cardiac events. Another area of service that I'll highlight is our breast care center. These are individuals, they're volunteers. While it's not necessary that they've had breast cancer, a lot of them are drawn to the breast care center because of the good care that they've received, and they want to help others. And when an individual has gone through something like that, some kind of a diagnosis like that, naturally their level of empathy is great, and patients can really feel that. And while the volunteers aren't there to tell their own stories, the level of support that they lend to these individuals while they're facing whether it's a test or a procedure is really helpful. And again, having somebody in that waiting room with them before their procedure, after their procedure, to lend that support is huge. Otherwise, you start thinking about the worst case scenario sometimes, and so those distractions are very helpful. So those are just a couple of areas as far as the medical specialty areas. And again, we're always open to looking at new and creative ways to engage our volunteers with different diagnoses or different needs that we have in the hospital. Our most common event is our annual Volunteer Recognition Luncheon, and that's held up at the Prescott Resort, generally during National Volunteer Recognition Week, which is in April. As a staff member, what I can say is when I stand on that stage and I look at the sea of people that are in that ballroom, we have 400 to 500 individuals that attend that event. It's inspiring. When I think about the contributions that they have made, it's just so awesome. Really gives us an opportunity to thank them, to honor them, to respect what their contributions have meant to our organization. And so we have our administrators there, we have all of our staff there, and we engage in some silly antics as well and try to entertain them as well as honor them. And so that's our biggest event that we host for our volunteers. If we have other events that are going on that are open to employees, we open those up to our volunteers as well. And then more on the logistical side, we have what we call reorientations every year, competency meetings, those kinds of things, and bringing volunteers together in their specific departments and their areas of service where we can really hone in on their skills, make sure that they're still comfortable doing what it is that they're doing, still motivated to provide those services. And what's cool about those events is maybe they volunteer on a Wednesday morning and they have never met the volunteer that's been there on a Friday afternoon. And so they have that opportunity in smaller groups, maybe 20 people, to really talk about their experiences, to brainstorm together, to talk about the highlights. And so it's an opportunity for them to meet other people and talk about what it is that they're doing. And it's, again, an opportunity to come together and with their shared experiences and have some fun meeting other volunteers. We're so fortunate in that we have a very vibrant chaplain program. And so we have about 60 volunteer chaplains between the two campuses, and they take call. So for instance, we have emergencies that happen. We're a hospital, we're open 24/7. Those emergencies happen sometimes at 3 o'clock in the morning. Sometimes those emergencies are at midnight. And so these individuals are agreeable to taking call for that, and they'll come in the middle of the night and minister to family members or to patients. Sometimes patients are dealing with a really difficult diagnosis and they just really need some spiritual support in the form of prayer, for instance. And so our chaplains will come in and support them in that way. It really is a vibrant program. We had a situation one time where a couple was supposed to get married and a hospital stayed, really interrupted that process, and so we had a chaplain that arranged for a little marriage ceremony in our chapel, complete with a wedding dress for the bride and flowers and a wedding cake. And it was quite the very small, very intimate, very meaningful event. And so that certainly is one of the highlights with what our chaplains do. And as an organization, we know that we can really meet the emotional and we can meet the physical needs of our patients, but we recognize that the spiritual needs are equally as important. And so I love the fact that Dignity Health YRMC has that spiritual component that's part of our mission, vision, and values, and our chaplains are very capable and very good at meeting that need. I think that what I hear the most is that they know that they've made a difference every time that they come in. Whether somebody says thank you or not, they know that they have done something to maybe lighten the burden, to help them navigate their way, to maybe feel a little bit more comfortable, a little bit less anxious. And they talk about that a lot when they really reflect on their volunteer service. The other pieces of it is the social aspect. They have lunch together, whether it's before their shift or after their shift, and they meet friends that way, new acquaintances. We've had a number of brand new friendships that have started that have been a result of volunteering. We also can claim a couple of marriages. So we've had individuals that have met as a result of volunteering and end up getting married. I remember on one of my first days working at Dignity Health YRMC, and a woman was talking about Fred, who worked, or I should say volunteered in the gift shop, and she said, he's a very special person to me, and her eyes were twinkling. And they actually started dating because they met as a result of volunteering. So no, we don't offer a single service, but it has happened. But the friendships are long-lasting, and that sense, again, I'm going to go back to that helper's high, is huge. And it's really fun to hear those stories because, of course, what we do when we try to match them in the right area of service is we're hoping for that really good opportunity and that good, meaningful experience. And when we find out that that indeed has happened, it's been a great, great thing for us to observe. I feel like I have the best job at the hospital because I get to be surrounded by people who say yes. And we ask them for favors and they continually say yes. And so we'll close this presentation with, again, thanking you for your attention to this vital topic. It's a great opportunity for people in the community to perhaps think about volunteering. And what I often tell individuals that if maybe that doesn't work into your life to volunteer right now, the next time you see a volunteer, make sure to thank them because they are doing some meaningful things for the organization or for the people that they serve, and they really can't be thanked enough. So thank you again. It was my pleasure to be here, and feel free to check out the other conversations that we have with this particular topic, our Healthy Conversations at Dignity Health YRMC.